Having him jump up and down on both feet with both feet pointing forward caused pain along the inside of his right heel bone. And right then and there, I figured out what must be done to get him to be able to jump pain-free. So if you experience a similar pain, then pay attention because you find this useful for you. This is especially so if you find that your heel bone is pre-positioned out to the side when you're standing on it. In most cases, this will cause the arch of your foot to collapse. My name is Manny and I am a physical therapist. So my patient comes in and we're gonna call him Mangos. Mangos comes in and he's like, Manny, I understand that you're the greatest physical therapist of all time, but I still can't jump on my right foot without experiencing pain. And I looked up at him and I said, Mangos, who helped you get back to walking without ankle pain after spraining your ankle? So Mangos looked up at me and he said, you did, Manny. And I said, no, you helped yourself. I was just there to guide the way. Now I need you to trust the process. So now after he wrinkles my clothes a little bit and roughs me up a little bit, we get to jumping. For 1 week, I had Mangos do rapid calf raises with the toes pointing in towards each other. The position of his feet here was intentional in order to protect the area of complaint when he's going through rapid calf raises. So essentially, this was the only position he was able to do the rapid calf raises in without inducing pain along that area. The rapid calf raises were also intentional to get him to prime his muscle or to get him to build a little bit more resilience along his muscles to be able to handle jumping motions. This worked brilliantly well, so the following week I had him going through jumping motions with both feet while keeping the toes pointed towards each other for the similar reasons mentioned prior. I had him work on this for a week or two, going for a couple sets of 10 daily. And then, of course, when I saw him again, we progressed this a little bit more. So the following week, I had him jump up and down with both feet pointing forward. I had him keep both feet pointing forward to expose his area of complaint a little bit more to see how we are doing so far. And of course, there was no pain when he tried this. He worked on jumping up and down with both feet pointing forward for about a week, couple sets of 10 daily till I saw him again. So when I saw him again, I wanted to progress this a little bit more. So I had him jump with both feet pointing out this time to give a greater exposure to the area of his complaint, which is what I would have done if I wasn't working with a human being, because nothing is really linear. I guess what I mean by that is that Mangos was ready to hop on just his right foot. Now, when hopping on his right foot, especially with the right rotational hops, that was mildly painful, but it wasn't as painful as it had historically been. Nonetheless, to protect that area a little bit more on a single leg hopping pattern, I just had him keep his foot straight ahead as he hopped. This worked brilliantly well because the following week he was able to hop with his right foot turned out to expose his area of complaint a lot more here without pain. So for the rest of the following week, I had him alternating between keeping his foot straight and then turning his foot out to the right, going back and forth for a couple sets of 10. So he came back the following week and he said, Manny, I have been able to jump without pain for a couple weeks now. So he rode off to the sunset, never to be seen again, discharged from PT. He never said thank you, now that I think about it, but that's okay. He paid for my services and that put dinner on my table. If you're having a similar pain, feel free to explore some of these progressions that I showed in this video. Of course, keep in mind that there are some glute exercises that were accompanied with this program as well, but I didn't want to make the video too long, so make sure that you are getting some foundational and functional glute exercises in as well. I would appreciate a like if you found this helpful, and of course, thank you for watching.